So the SWOG S1216 study is an NCI-led phase 3 randomized trial comparing androgen deprivation therapy plus TAK700, which is a CYP1720 lyase with ADT plus Bicalutamide in men with newly diagnosed metastatic hormone-sensitive prostate cancer. The presenting and the chair for this study lead author is Dr. Neeraj Agarwal. Fortunate to be a co-chair for this study. And this study enrolled 1,279 patients and randomized them to androgen deprivation therapy, TAK700, at a dose of 300 milligrams twice a day versus androgen deprivation therapy and bicalutamide 50 milligrams once a day. Primary endpoints were overall survival. Secondary endpoints were progression-free survival, PSA at 7 months, and adverse event profile. Patients were stratified based on the performance status, minimal versus extensive disease, and early versus late induction. During this design of the study, the statistical assumptions were alpha of 0.025 with a 90% power. The improvement was expected to be 33% over a hypothesized overall survival in the control arm of 54 months. And the demographics were very well balanced. Majority were Caucasian males, and then 10% in each group were Black patients. The median follow-up was 4.9 months. And in the primary analysis, surprisingly, the control arm of ADT and bicalutamide outperformed the assumptions. The overall survival in that arm was 70.2 months. And in the TAK700 arm was 81 months, which was 11 months better. However, it did not meet the pre-specified value, which was required for it to be statistically significant. The hazard ratio favored all categories, including race, performance status, minimal versus extensive disease for TAK700. The TAK700 significantly reduced the risk of progression by 42%, and the PSA responses were significantly better compared to bicalutamide, with 58% patients achieving complete PSA response as opposed to 44% in the bicalutamide arm. The toxicity of hypertension and fatigue was more pronounced in the TAK700 arm. And interestingly, we saw that 61% patients in the TAK700 arm and 77% patients in the control arm received subsequent life-prolonging therapies. And this study is very important because the median overall survival of 70 months in the control arm is the highest that we have seen to date in any contemporary phase 3 trial in hormone-sensitive prostate cancer. And even though the 11 months improvement in overall survival with TAK700 was clinically meaningful, it did not meet the pre-specified criteria for statistical significance. And this trial sets a new benchmark for survival estimates for keeping in mind when designing future trials for this patient population.